of the clavicle, right? So when you show this to Dr. Porter or I, you'll explain that. If it comes anterior, then of course the restriction is A to P. If it's anterior and superior, then whatever the misalignment, remember that's the opposite is the line of correction. On the AC joint, your contact point is here. For the glenohumeral joint, your contact point's down on the elbow, right? For the scapula, it's either the inferior medial or inferior lateral border. These are your contact points. For the posterior humerus, it's here. And for the posterior lateral radial head, it's here. Okay? Any questions about those? Okay, so that's all your contact points. Your motion palpation for the SC joint is what? You're going to shrug your shoulders, protract, retract your shoulders. Go through these motions. Okay? Get all of them involved. Okay? In order to motion the AC joint, you're just going to compress it down by stabilizing into the humerus here, and you're going to just push this down here. For the glenohumeral joint, you're just going to motion it, stabilizing here. I told you some other ways to examine that, such as raising the arm and so on, but we're not going to do those for this test. Okay? For the scapulocostal joint, how do you motion those? If it's gone, if it is rotated medially or fixated in the medial position, that's right. And if it's lateral, you're going to have the patient prone, arms down at the side, pushing this way, right? To motion the ulnar, the ulnar humeral joint, it's just like this. Remember, you're supposed to feel for that spongy end feel. Or the bony line, the spongy end field tells us there's a problem. And if you're looking at the proximal radius relative to these two joints that's involved, you're just going to pronate and supinate the patient's hand while you're palpating. Okay? Okay, so who's our model today? Everybody know?